Hello, everyone. How are you doing? In this video, I want to talk about a subject that is often surrounded by taboos, nervous laughter, and a lot of silence, but which is incredibly important for your health. I want to talk about anal sex. I want to clarify some major issues, and more importantly, I want to bring you 3 specific clinical cases that happened right here in my office this week. These cases will provide significant clarification and explanations for you who are part of our team here on this channel. Before we dive into the content, I have a special invitation. We are constantly launching new projects and sharing information that sometimes doesn't make it to YouTube because it's a bit more private or intimate. We have created a Telegram group. If you don't know what Telegram is, it's an app very similar to WhatsApp. You can download it on your phone, click the link in the description below, and you will be inserted into our private, exclusive group where I share insights and answer questions more directly. So, check that link after the video. Also, if you aren't subscribed to the channel yet, please subscribe. It's totally free, and if you like the content, give it a thumbs up. It helps us immensely to keep doing this work. Now, before I start discussing the mechanics and risks of anal sex, I need to make a very important disclaimer. I am not here to tell you whether anal sex is right or wrong in a moral or religious sense. I am not here to discuss your personal beliefs or what your faith permits. As a specialist, as a coloproctologist who deals with the diseases of the intestine, rectum, and anus, it is my job to speak about the anatomy and the medical consequences. There is a lot of information in the media, in magazines, and on social media that is not explained by specialists. Often, this advice is dangerous. The person who needs to address this topic is a doctor who sees the results of bad practices in the operating room. I want to bring you 3 very curious and, honestly, quite exclusive cases. I don't think you will find another video on the internet where a specialist breaks down these specific scenarios so clearly. By coincidence, all 3 of these cases happened this very week. I'm actually recording this just after finishing a series of procedures, so these cases are fresh in my mind. Let's look at the first case. A male patient arrived at my office with a complaint of recurrent urinary tract infections. This was a young man in his early 40s, suffering from one infection after another. Now, medically speaking, it is very common for women to get urinary tract infections because the female anatomy places the vagina and urethra very close to the anal region, making contamination easier. However, for men, it is much more difficult. The male urethra runs through the penis and is quite long, making it hard for bacteria to travel all the way up to the bladder to cause an infection. So, whenever a man presents with a UTI, let alone recurrent ones, we treat it as something that needs serious investigation. This patient told me he had already seen 5 other doctors. He had taken approximately 10 different types of antibiotics. 10. And he told me, "Doctor, I never get better." I began to interview him, and I had to ask the intimate questions that only a specialist asks. I asked him about his sexual habits. He confirmed he was married. I asked, "Do you engage in anal sex with your wife?" He replied, "Yes, doctor, very frequently. In fact, about half of our sexual activity is anal intercourse." That immediately turned on a light for me. I ordered a specific type of exam, a urine analysis with a culture, but I specifically requested a search for verminosis, parasites, in the urine. The lab technician actually called me to ask if I had made a mistake, thinking I meant to order a stool sample. I told him, "No, I want you to look for parasites in the urine." When the patient brought the results back on Monday, the surprise was massive for both him and the lab. He didn't just have bacteria, he had a parasitic infection in his urinary tract. Worms. Specifically, Ancylostoma duodenale. I asked him, "Do you use a condom when you perform anal sex?" He looked at me and said, "No, doctor. It's my wife. We've been married a long time. We don't use condoms." And there is the problem. This is the lesson of the first case. You must remember that the rectum is the most contaminated part of the human body. The mouth has bacteria, the stomach has more, the small intestine has more, the colon has even more, and the rectum is the reservoir for all that waste. When you engage in anal intercourse without a condom, you are exposing the urethra, the opening at the tip of the penis, to that massive bacterial and parasitic load. Because this man was doing this repetitively without protection, he acquired a parasitic infection through his urethra. He and his wife hadn't taken deworming medication in 10 years. So, the rule is simple. Condoms are non-negotiable for anal sex. It's not just about preventing pregnancy or STDs. It is about preventing severe bacterial and parasitic infections in the male urinary tract. Now, let's move to the second case. This week, I had to perform urgent surgery on a female patient. She came in with a severe laceration, a tear of the anal sphincter. The sphincter is the muscle ring that controls the anus, and she had torn it, resulting in significant pain and bleeding. We had to perform a sphincteroplasty to repair the muscle. You might be thinking, does all anal sex cause this? Absolutely not. But when I investigated what happened, two major errors stood out which caused this trauma. These are mistakes I see constantly. The first error was regarding lubrication. She mentioned they used a numbing cream and anesthetic ointment. This is a dangerous mistake. You should never use anesthetics for anal sex because pain is a limit. It's a warning signal from your body that you are stretching too far or tearing. If you numb the area, you lose that protection. Furthermore, lubrication must be abundant, and it must be a water-based lubricant. And here is the secret that many miss. You must lubricate both parts. You need to apply lubricant liberally to the anus, and you must also apply it to the penis or the object being used. Lubricating just one side increases friction and the risk of tearing. The second error, and this is perhaps the most common cause of injury, was the position. She told me they started the intercourse in the genupectoral position, commonly known as doggy style, or on all fours. Here is an anatomical fact that you need to understand. The rectum is not a straight tube. Despite the name rectum coming from the Latin for straight, it is actually curved. It follows the curve of the sacrum, the bone at the base of your spine. When a couple starts anal intercourse in the doggy style position, the angle of entry is often completely straight. Geometrically, the penis enters and hits the front wall of the rectum directly, rather than following the curve of the canal. This direct impact against the rectal wall is what causes fissures and tears. The medical advice I give to my patients is this: the safest position to start anal intercourse is the lateral decubitus position. That means lying on your side, spooning. Why? Because in this position, you can control the angle better. And here is the golden rule for angle. The tip of the penis must always point towards the recipient's navel. If you aim towards the belly button, you align with the natural anatomical curve of the rectum. If you aim straight up or straight back, you are going to cause injury. So, correct the position to lying on the side, use water-based lube on both partners, and aim for the navel. Now, speaking of maintaining the correct angle and mechanics, I know that for many men, maintaining that necessary firmness and blood flow can be a struggle as we age. And relying on pharmaceutical pills often brings side effects that we doctors worry about. However, there is a natural way to address this. I recently reviewed a presentation about a bizarrely simple 7-second morning ritual, a natural purple tonic that tackles the biological root cause of performance issues rather than just masking them. It's helping thousands of men restore their vitality and firmness naturally. I highly recommend you take a look. You can point your phone's camera at the QR code on the screen right now to watch the full explanation, or you can simply click the link I've pinned in the top comment below. It's a fascinating alternative to dangerous medications. Now, moving on to the third case, which is also very common and very distressing for women. A patient who I had previously operated on for an intestinal issue came in for a routine checkup. During the consultation, she complained about a chronic vaginal discharge that just wouldn't go away. She had vaginal infections of repetition. She told me she had been to gynecologists. She had been diagnosed with colpitis, vaginitis, and even salpingitis, inflammation of the tubes. She was frustrated. She said, "Doctor, I can't stand using vaginal creams anymore. I take antibiotics. It goes away for a week, and it comes back." You aren't a gynecologist, but do you have any idea? I asked her the same question I asked the first patient. Do you engage in anal sex? She said yes. Then I asked the critical question. Does it ever happen that you switch from anal sex to vaginal sex during the same act? She hesitated but admitted, yes, sometimes that happens. It's in the heat of the moment. I told her, there is your problem. We have to go back to the concept of contamination. As I said, the rectum is the trash can of the body. It is full of E. coli and other fecal bacteria. The vagina, on the other hand, has a very delicate pH balance and its own flora. You must never, under any circumstances, move from anal penetration to vaginal penetration without changing the condom or thoroughly washing. Even if you are married, even if you trust your partner, even if you are clean, you are physically dragging billions of bacteria from the rectum and depositing them directly into the vagina. This causes massive infections that are very hard to treat because you are constantly reinfecting the area. If you want to change positions, the sequence matters. Vaginal to anal is fine regarding bacteria. Anal to vaginal is strictly forbidden unless you remove the condom, wash, and put on a new one. So, to summarize these 3 lessons from this week's clinic. 1. Men, use condoms for anal sex to protect your own urethra from severe bacterial and parasitic infections. 2. Prevent injury by using water-based lube on both partners and starting in a side-lying position, aiming towards the navel to follow the natural curve. 3. Never switch from back to front. The contamination from the rectum will destroy the health of the vaginal flora. These are intimate topics, yes, but they're health topics. They're safety topics. Please share this video. Send it to your partner, your friends, or anyone you think needs to hear this medical perspective. It helps us break the taboos and prevent people from ending up in the operating room. Don't forget to join our Telegram group for more direct communication, and I'll see you in the next video. Stay healthy.